Hello, good afternoon, friends. Today we will discuss about congenital anomalies. This is class for child health nursing, and it is very important topic which comes in examination, theory as well as practical. So, what is congenital anomalies? Congenital anomalies or congenital abnormalities can be defined as structural or functional malformation or abnormalities. For example, metabolic disorder, that is functional abnormality, or cleft lip or cleft palate, that is structural malformation, that may occur during intrauterine life and can be identified prenatally. Then it can be identified as at birth also, and sometime it may be detected later in the infancy, such as hearing defects. Congenital anomalies are also known as birth defects. So in examination you may find congenital anomaly word, congenital malformation, congenital abnormalities or birth defects. So what is the effect of this problem? Congenital anomalies have significant impact on individual, family, healthcare system and our society. It may lead to long-term disabilities or even sometimes death. The most common and severe congenital anomalies may be heart defects, neural tube defects, Down syndrome, etc., which are difficult to treat, and sometimes congenital anomalies may be moderate, such as cleft lip and cleft palate, and these will be easy to treat. Although congenital malformations or anomalies may result of one or more genetic, infectious, nutritional, environmental factors, it is often difficult to identify exact cause. Still, we may find some factors which may lead to birth defects. So, what are those? These factors are grouped under genetic factors, socio-economic and demographic factors, environmental factors, infections, maternal nutritional status. Now we will discuss them one by one, and then when we can understand possible uh, causes for the birth defects. First of all, genetic factors. Genes play an important role in congenital abnormalities. This might be through sudden change in the genes, which is also known as gene mutation, and some ethnic communities have comparatively high prevalence of genetic mutations such as cystic fibrosis or hemophilia type C. Then socioeconomic demographic factors. Low income may be an indirect determinant for congenital anomalies. With a higher frequency among resource-constrained families and countries, this high risk relates to possible lack of access to sufficient nutritional food by the pregnant women. An increased exposure to some harmful agent factors such as infection and alcohol may also lead to congenital malformations. Low access to healthcare facilities and insufficient screening facility may also lead to congenital malformations. Maternal age is also a risk factor for abnormal intrauterine fetal development. Advanced maternal age increases the risk for chromosomal abnormalities, including Down syndrome. Next factor is environmental factors. Maternal exposure to certain pesticides and other chemicals, as well as certain medications, alcohol, tobacco, radiation, environmental pollutions during pregnancy may increase the risk of having fetus or neonate affected by congenital anomalies, particularly if the mother is exposed to these environmental risk factors or nutritional deficiencies during first trimester. Infections. Maternal infections such as syphilis, rubella are a significant cause or important cause or important risk factor for congenital anomalies in low and medium income groups. More recently, the effect of in utero exposure to Zika virus on the developing fetus has been reported. So these infections may lead to congenital malformations. Then maternal nutritional status. Maternal folic acid deficiency may increase the risk of having babies with a neural tube defect such as spina bifida. Excessive vitamin A intake may also affect the normal development of an embryo or fetus. Now, what can be done for prevention of birth defects? This is very important. If we are able to explain these points to the community, the chances of birth defect may be less. Firstly, adolescent girls and possible mothers should have healthy diets, including a wide variety of vegetables and fruits, and maintain healthy weight. Then the chances of birth defects will be less. An adequate dietary intake of vitamins, minerals, particularly folic acid, should be ensured in adolescent girls and pregnant mothers. Why adolescent girls? Because they will uh, become future mothers. So this nutritional status should be supported in advance. Pregnant women should avoid harmful substances, particularly alcohol and tobacco. Pregnant women should avoid to travel to the regions experiencing outbreak of infections known to be associated with congenital anomalies, and that we have already discussed. Try to reduce or eliminate environmental exposure to hazardous substances such as heavy metals, pesticides, etc. during pregnancy. Controlling diabetes prior to and during the pregnancy through counseling, weight management, diet, and administration of insulin when required. So this is also an preventive measure. Ensure that exposure of pregnant women to medicine or medical radiation such as X-ray is justified, but be careful. Health risk benefit analysis. It means all medicine and investigation should be done only after consultation with your gynecologist. Vaccination, especially against rubella virus for children as well as women, is very important preventive measure. Increasing the and strengthening the education of health staff and other involved in promoting and prevention of congenital anomalies. And screening of for infection, especially during pregnancy or just when a pregnant mother is registered during antenatal period, especially rubella, varicella, syphilis, and consideration of treatment before pregnancy. Thank you, students. This is a very important topic. You can subscribe the channel for latest update, and now we will start the class in Hindi.